I'm Tina Duong. I work at Children's National Medical Center, and today we're going to talk about pediatric physical therapy in muscular dystrophy. So muscular dystrophy, a good way to describe it is basically meaning the muscle is sick. And so it's typically an umbrella term. So if you ask me how many muscular dystrophies are out there, there's lots of muscular dystrophies out there. It's similar to how you use the term cancer. So there's lots of different kinds of cancer, just like there are a lot of different kinds of muscular dystrophy. If your child has muscular dystrophy, it's a chronic disease, and so there's going to be ever-changing muscle weakness. And so a lot of times you go to a PT so they can assess where the weakness is coming from and teach compensatory mechanisms to make doing life skills a little bit easier. So a lot of times with muscular dystrophy, what you're looking for is not necessarily gaining some skills, but obtaining some kind of skill they're not able to do in a different manner. A lot of times parents are happy with maintaining what their child basically has, because most of the parents know that with muscular dystrophy being a chronic progressive disease, that what they fear most is losing skills. And so your job is basically to help maintain what they are able to currently do. And if they're not able to do it, to help adjust by recommending different kinds of equipment for them to continue to eat by themselves, brush their teeth, or go to the bathroom by themselves. Based on the muscle weakness or the distribution of weakness, we changed the plan of care basically to help them move a little bit easier. So a lot of that will be shifting weight, and so as you can see, a lot of therapists would use balls, and the reason why we use balls would be to help them learn how to shift their weight to be able to move their limbs a little bit easier. A lot of times you want to teach confidence so that they have confidence in their body's ability to do something. So it may be that you have to bring a task back to make it a little bit easier so that they are comfortable with what their body's able to do. For example, negotiating stairs. To get up from the stairs, sometimes you need a little bit more space for them to lean and use two hands. You teach them techniques to be able to, if their upper body is stronger, to, in a sense, pull themselves up. So those are just different ways to kind of modify an activity to make it functional for them. The joy in being a pediatric physical therapist, especially one who treats kids with muscular dystrophy, is you're involved in their life from the moment you meet them. And so you're probably going to be the one that goes to their high school graduation, their kindergarten graduation, all of these life events, because you're such an important part of the family. And so part of that is not only teaching them how to use their body to move, but for them to be advocates for themselves. And so as they grow up, you're teaching them skills, motor skills to be independent, but you're also teaching them skills on how to advocate for themselves and ask for help when they need it, because that's just as important as the ability to move. I think therapists empower families and patients a lot because they're a coach, they're a teacher. And those are the things that make families feel like they're doing something for their child when sometimes it feels a little hopeless.